Good evening. It's already borne the brunt of Europe's COVID-19 pandemic, and tonight, Italy's death toll is back on the rise. The government says 636 people have died in the last 24 hours, an increase of 111 on Sunday's death toll. Health experts are hoping the country is past the worst of the crisis, and despite the new deaths, there is cause for optimism. It's had the lowest daily total of new cases since March the 17th. Well, for more on this, let's cross straight over to Rome, where we can speak to our correspondent, Georgia Alandi. Georgia, the authorities were hopeful that they were turning a corner here. So have today's numbers changed that outlook?
Hi, Oliver. Well, the latest figures do suggest that Italy has finally turned the corner. You have to look at the wider picture here. The number of daily deaths has been decreasing in the last few days. Today's death toll, yes, is bigger than yesterday, but most of these deaths occurred in the Lombardy region, suggesting that the outbreak is slowing down in the four worst hit regions in the north of Italy. The second good news is that the overall number of people who are being treated in intensive care units has been decreasing for the third consecutive day. And also, as you mentioned there, the total number of new infections has been decreasing. And the president of the Italian National Institute of Health said that the curve has started to go down, meaning that if it continues to do so, then the government will be able to plan the second phase of the government's response to the outbreak. And that is very important, because if you have less infections, then you will have less deaths in the coming days.
And Georgia, Italy has become the first EU country to test for the virus using blood. Just how effective are these tests, and could they be rolled out to the rest of Europe?
Well, yes, Oliver, that's what the second phase is really about. That means that people will be required to live with the virus. In other words, they will be allowed outside their confinement, but still respecting a few measures. Now, Italy's health minister explained that these would involve a 5-point plan, including a way to detect those people who have already experienced the coronavirus, who have developed coronavirus antibodies, and together with that, contact tracking smartphone apps that could track the movements of people who test positive for the virus. Now, Italy is a pilot case here in Europe, and if it does well, then more countries would follow Italy's example.